Bulavinaka, good evening and namaste. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight is the Minister for Health, Dr. Ratu Antonio Lalabalavu. A lot has been said about our health sector, real challenges that remain, and the person at the helm of it looking into things and the situation at hand. It's not an easy task to be the Minister for Health during these times with a lot of things occurring on a daily basis. We are here at the Minister's office. First of all, Dr. Ratu Antonio Lalabalavu, thank you very much for accepting our invitation to appear on the show.
Thank you very much, Vijay. Thank you for having me on the show. It's an opportunity, as you said, to address to the public the ongoing challenges within the ministry and how the plans we have put in place to try and address it.
We will not be pussyfooting around issues. Straight away, you have a mammoth task. We have had issues in relation to lifestyle diseases, non-communicable diseases, normally known as NCDs. 80% of the deaths in Fiji are through NCDs. We have a crisis as far as the drug situation is concerned, and we can see drugs is causing a big issue at our only psychiatric hospital at St. Giles Hospital, grappling with many issues there to look at mental health issues, but now with almost doubling up like a drug rehab center. And then we have what you have just termed as an outbreak now, HIV, some of the big challenges. Minister, are you concerned?
I'm very much concerned, simply for the fact that since taking office, I've seen the numbers that have been brought to my attention in terms of NCDs and what the ministry is doing about it. With that being said, if you look at NCD, you look back 5 to 10 years, then you'll try and assess what are the programs that have been put in place, the investment that have been put in place to try and address this. One in particular is the STEP survey. The last STEP survey was done in 2011. In fact, it should be done every 5 years. We in the process of not only doing it, but completing the STEP survey from last year till this year. Now what the survey will tell us is whether our programs have worked or not, whether the investment that have been put into those programs or other policies that have been put in place have contributed to a decline in the NCDs. The numbers will tell us that it keeps on rising. So in taking office, I'd ask members of the senior management, and especially those that look after the programs of NCD, to see how best we can move forward in looking at some of these programs. Mindful of the fact that to deliver these programs, you need a good human resource team to do it. Public health team, preventative team, or health promotion. That up until now is one of the major factors of challenge that we are facing, especially on human resource. You need adequate numbers to do public health. But because our numbers are not 100%, and more work is now diverted to clinical. So that is also one of the reasons why I believe that we are where we are right now because of the human resource issue. You pointed out drugs and consumables. Yes, that is a fact. And it's something that we as the ministry, together with government and our development partners and the private sector, we'll have to work together to see how we improve to ensure that we have the adequate or the right medications here on time, meaning the right medications, the life-saving ones. We order 100% of our medicines, consumables overseas. Factors that delay the arrival of these items, some are beyond our control, while others are within our control. And it is those that are within our controls is something that we as a ministry are working to improve on.
We will talk about medicine supply and shortage in our segment when we do go to Fiji Pharmaceutical Services. But Minister, are you playing a catch-up game, which is resulting in a lot of neglect as well?
Very much. You've said it correctly. Since taking office, I've realized that we are playing a catch-up games in nearly all aspects of Ministry of Health and Medical Services service delivery. You're talking about infrastructure, human resources, procurements, and so forth. So, yes, looking after the ministry itself is a challenge, but to play catch-up gives an added more challenge to the work that is to be done.
Why a catch-up? Why are you playing catch-up?
Well, if you look at the status of our infrastructure, since taking office, I've doing the tour initially, we have noticed that most of our infrastructure are not well maintained. Then you look at the staff that our civil servants, doctors, nurses, and other staff that we do send them over to work in those facilities. Since taking office again, that was the first time I had entertained the Fiji Nursing Association in this office. And I had allowed them in that first meeting just to vent their frustration, because I knew as a minister, your role is to guide, and not only to guide, but ensure that you talk regularly with the staff that you lead. And as such, since coming in, that is one of the challenges, I believe, has been a setback in which we are playing catch-up. So I allowed them to come in, make their submissions in terms of how we can improve their working conditions. Okay? Then you talk about issues such as equipments and consumables, which also going around. I see most of them either are not working or just barely functional. And again, we have to go back to human resource on how we can beef up our biomedical team to enable them to go out and do servicing on time. We have some new equipments in place. Again, some equipments are there, but due to the late development in infrastructure, I'm talking about electricity wiring, it has affected service delivery, because in some hospitals we aren't able to fully utilize the new machines because of the electricity load. We just can't take it.
Accountability and resource management is always important. One of the things is, and what we see, for example, the Office of the Attorney General, only last year, at the end of last year, their annual reports from 2006 to 2022 were submitted to Parliament. What about the Ministry of Health annual reports?
So
I'm asking the question so that you can assess the performance and resource management of your ministry.
Agree. Last term, being a member of the Social Affairs Committee, we do scrutinize annual reports, and coming into taking up this role, I've realized that the Ministry of Health annual reports were late. So that was one of my first priorities, And suffice to say, we have submitted, I believe, from 2016 to 2021. And together with that, I have been briefed that even 2022 to 2023 annual reports are now being vetted to be published.
So in terms of being aware, and people watching this show would be saying, Minister, we just want to know when can I go to the hospital and everything is available, things are working, medicine is available, I have a doctor who can see me, nurses are kind enough to look after me well. They would be asking why that is not happening at times.
There are a number of factors which I believe those circumstances happen. One is to do right now is the human resource part of it. In our briefing last week, senior managers meeting on the human resource, I was told that overall numbers was hovering at around probably 70%. Now, with that much numbers, and then you divide those numbers to actually look after the facility, not only looking after the facility, but looking after the busy facilities. And I'm talking about the main one, Supernusory Corridor. Okay. You can only do so much as to allow certain services with those numbers.
You mean staffing numbers?
Staffing numbers. Okay. So, you know, it is an issue. It's a challenge, and it's something that I will have to ask members of the community out there to please bear with us as we try and improve the numbers, and also the working conditions, the infrastructure itself. It has to do with the holistic approach on providing adequate healthcare service. We're trying to improve all aspects.
Unfortunately, also at the same time, it's a life and death situation when a person goes in, and you have the workforce issue. How are you balancing it off to make sure that you don't have situations where those who could be saved when they come in, I'm talking about critically ill patients who come in, to ensure that they come out alive after the experience at the hospital?
So, good question. I had raised that in our senior managers meeting in terms of the role that we play. Bottom line, what is our aim? The vision is for healthy population. But in terms of service delivery, I had mentioned this to a senior managers meeting in that bottom line, it's about saving a life. Okay? Bottom line, it's about saving a life. So from the highest civil servant, the permanent secretary, right down to the lowest paid general wage earners, their role or the outcome of what they do should be the same. And that is, if you do this right and take ownership of your work, at the end of it, you are saving a life. We are faced with these challenges, but we still have to provide service. And in doing so, I would like to instill that in all our staff, that even though you're facing challenges, but the work that you do will somehow save a life.
There's a report that came to me that about $80 million of unspent money in your last budget for the financial year was returned to the Ministry of Finance. Why did that happen?
So, in budgetary allocation is based on submissions. For the savings or the unused budgetary allocation that we got was mainly around SEG 1, which is human resource. We budgeted for the whole establishment, but there were vacancies in some of those establishments. Like I said, our human resource capacity is hovering around 70%. The other one which contributed to the savings, I believe, is the capital expenditure. I had mentioned this in Parliament in that even though we are given the money to spend, our ability to spend is dependent on the capacity within probably Ministry of Infrastructure, who looks after the work. So for this financial year, we are trying to improve on those processes in that we do spend more or increase our percentage of utilization, budget utilization. And in doing so, we are identifying certain programs or certain works that we believe, if we communicate better with the relevant ministry, relevant agencies, then we can be able to spend more on the budget utilization. But for the last financial year, yes, there was some savings, but it's mostly due to human resource, which was budgeted for but not spent, and also capital works budgeted for but was not done.
When you say 70%, you're working at 70% capacity, and why aren't the positions filled? You can't find the people, the caliber of people you're looking for?
So,
or people leaving at a high level?
People are leaving, even though we are hiring, people are leaving. And you can go back right down to the capacity within the training institutions. Population size has increased. The need for more doctors, nurses, but the capacity for learning is still the same. So the numbers remain the same in the learning facility which produces these healthcare workers. That can be one. And also it's just when they do graduate, for instance, in medical imaging technologists, when they graduate, I've been told that the certificate or the degree is also recognized in New Zealand. So even though we put an expression, or we put some vacancies out, probably 20, only 9 applied. So the rest, they went straight to the private sector or gone for greener pasture overseas.
What's the solution there? What are you doing about it?
Well, solution, as I've said earlier, it's allowing those organizations which, for instance, is FMA or FNA or medical imaging technologist, their CSN, to come on board with their submission to see how we can improve their remuneration and working conditions. We've seen an improvement for a few of those cadres that we have discussed and accepted that submission. But it is a process whereby they have to come to us. The ministry has to put it to the Ministry of Civil Servants, so to ensure that their interests are heard and it is met also. So we've done that with a few of the cadres of our allied health workers and specialist staff, and the outcome has been good on our part because we have retained some of the staff.
The doctors, it seems like the doctors' salaries had gone up, reviewed and gone up. You've managed to retain doctors, but you still have a lot of nurses who had left, and they were a bit more senior level, and it's hard to, again speaking from the medical terms, to replace a very senior nurse with someone who just graduated.
It is a challenge when senior people leave, because you can't train experience straight out from the university or nursing school or medical school. Experience, you have to go through a whole lot of years to learn what you know and be able to practice it. And as it is, yes, we are losing some of our experienced healthcare workers, mainly nurses. And again, it goes back to how we as government or as the ministry can incentivize them to stay on board, to stay and continue the work with us. We have some very, very dedicated nurses, to say, who have stayed on, and for what we are giving them, we hope that they will stay for longer. But it's something that to look into the overall aspect of how probably the Ministry of Civil Service, how would they want the respective ministry to retain their most senior civil servants.
Yeah, I mean, the issue about Ministry of Civil Service, we had a bit of a situation where Ministry of Civil Service said that there will be no overtime paid, and you had some of your critical services like X-ray services and those other lab services where I believe notices were put up that you just only could operate during normal hours. Unfortunately, you cannot do that for hospital services. Are you trying to get the Ministry of Civil Service to understand that you're not just an 8 to 5 kind of organization?
Yes, when that incident was brought about, we had a good discussion with the Ministry of Civil Service, and we had highlighted that, look, our ministry is probably the one-of-a-kind ministry where our work is not, as you said, 8 to 5. Most of our work is not 8 to 5. So in that essence, some of our specialty, understaffed as it is, they need to be incentivized with overtime so that they can continue the work that they do. And we are talking about staff who probably are high-grade level staff, who are not entitled to overtime. But just because the numbers are low in that department, we have asked for the Ministry of Civil Service to consider that they be exempted. And this, we've also asked that this will have to continue until we get the minimal numbers back on the operational side of it.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
Oh my gosh! Oh, what's in the box?
You're probably wondering, what's in the box? Well, if you must know, it's actually me. Before you call the police, I'm actually an app. The all-new Fiji Village app. Here's an update. See what I did there? I gave you an update. What's new? Well, for starters, I look different. My new layout also comes with stories if you're looking for something short and sweet. I will bring you the latest news on the dot so you stay updated. You're welcome. You don't have to go anywhere for content because I bring the content to you. Not only can you listen to your favorite radio stations, you can also watch online video content. Which reminds me, do you love sports? Well, guess what? With the Fiji Village app, you can stay up to date with your favorite sports and scoreboards, no matter where you are. Your #1 news website just got better with an app. Download and get updated now.
Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. This week we are speaking about health, a very critical issue that continues to come up in our everyday lives, and we're thankful to the Minister for Health, Honorable Dr. Ratu Antonio Lalabalavu. We are here at the CWM Hospital. A lot has been said about CWM Hospital, Honorable Minister. What is being done to fix the infrastructure here at this hospital?
In terms of fixing the infrastructure, first of all, we have requested budgetary allocation in terms of the submission that is being brought forth by the medical superintendent and the submission that he has received on behalf of the staff that work here at CWM. There's also the ongoing partnership with one of the development partners in terms of the master plan. That is something that the agreement between Fiji government and DFETE. With that being said, for the allocation that has been granted to us for the improvement of the infrastructure, we are trying our best to ensure that we do things in a timely manner. But again, there are challenges that we as a ministry face and CWM face in that the work that needs to be done is somehow beyond the ministry or beyond CWM. And for that, we usually require an ongoing discussion with the relevant stakeholders, being works, probably finance. But again, it is something that we take on a day-to-day thing in terms of what needs to be improved, how fast we can improve it. There are various aspects within the CWM that have different challenges. One can to do with infrastructure on the probably the air conditioning, the inlet outlet of air or leakage.
Which is causing all the mildew in the ceilings.
Very much, as you have seen. So to tackle that, yes, we have budgeted for it, but to spend the money and ensure that the repairs are done in a timely manner so as not to affect healthcare service delivery, especially the ones you've seen here in CWM.
We've just come back from the cardiac unit, and your most critical patients where you do your operations. You have a big issue with your air conditioning system. Even some places you had to isolate, and we see it's raining heavily and it's leaking as well. Who are you talking to fix that situation? Why is it taking so long?
So from our end, we are talking with the relevant ministry, which is Ministry of Infrastructure. Why is it taking so long? I believe that is the question you need to ask the Ministry of Infrastructure. The money has been allocated to the ministry to spend for that reason, for the improvement of the infrastructure. But again, we are mindful of the fact that the capacity probably within the relevant ministries to carry out the work. So, if that is delayed, service is being delayed, people are affected, and lives will eventually be lost.
As the health minister, have you pushed the Ministry of Works to get on with it?
We have. In the last year, when it was brought to my attention about the issue at the theatre, I had asked the Permanent Secretary and his team to do a walkthrough with us, similar to the one that you just did. And I had specifically asked that the issues of infrastructure within CWM that it be prioritized. And I was told that it will be prioritized.
When was that?
Last year, June last year.
June last year, we in January this year.
Yeah.
Has there been any movement?
There have been some movement, but not to the extent that we would have thought that it should be at the moment.
We came back from your operating theatres. You have 8 here. Only 4 are functional. The other 4, I see there's some work going on, but far from over yet.
We've been told an extra 3 months to complete the whole work. But again, with delay in repairing, it also causes a delay in service delivery from our end. And that is, doing surgeries, saving lives.
You have a backlog of surgeries now?
We have a backlog of surgeries. We've been operating with 4 theatres for some time now, and I've been told with 4 theatres it's emergency mode. What we have discussed with our surgeons is an alternative site to do surgeries, especially elective surgeries. We've done that last year, and we're in the process of renewing some of the works to be outsourced to the other private theatres.
I know you under the pump here as the Minister for Health. Have you taken it up to Cabinet about the delay, and as you said, it's a life and death situation, about some of these things that are delayed?
Yes, look, I've taken it up to Cabinet, to the highest level of decision making, and I've been given the assurance that support will be given to the ministry, especially the works within the CWM hospital, that it will be prioritized.
So you're saying the money is there, it's about getting the work done?
The money is there. We've asked for submission in terms of allocation of funds for specific projects, especially infrastructure improvement, and we've been given the funds. But it's the process of using up the funds to do the work to correct the infrastructure defect that is at times within our control, but mostly beyond our control, as I can see.
The Medical Association President Dr. Alepate Wakamodea says it's troubling the doctors as well, that sometimes they need counseling based on the life and death situation, that they could have helped patients, but because of some of these issues, it has negatively affected the patients. How do you deal with the staff who work for the Ministry of Health and they're faced with these types of scenarios?
That is one of the challenges that they have to go through. And I have been personally receiving phone calls from surgeons who had said exactly what you mentioned. Just because of the delay in surgery, lives have been lost, and they could have done something. But because of the state of our infrastructure as it is, we need to work probably much faster, much smarter, to ensure that these facilities are brought to the standard that it's supposed to be in, so it can be operational. If not, then we'll just keep losing lives here at the theatre. But it's something that we as a ministry now are going door to door and knocking on the respective ministries' door and telling them, look, this is delayed, we need to do this now, otherwise this will continuously be happening.
Are you getting success?
Yes, I
What do you think should be done to make sure it happens?
I can say just to be prioritized, Send a team here and do the work. If they have to do work here overtime, then do so, because
So be it.
Be it. Because if you delay the work, then the surgeons will tell you, they're losing lives that they could have saved.
We see today there's no work going on. So some days they work, some days they don't.
Well, that's a question you can ask the ministry.
How many lifts do you have at CWM and how many are not working?
So we have 6 and 2 are working, 4 are not working.
And 2 in the critical area here. We saw the video of critically ill patients being carried by your staff up and down for surgeries. You're a doctor yourself, to be put into that situation, quite a big ask?
It's a big ask, but if the benefit outweighs the risk, consent is usually taken from the patient first. Then, if it has to be done, it needs to be done, surgery. So again, if the benefit outweighs the risk, we will ensure that before doing the lifting that all support staff are there.
We would like these lifts to be fixed. I'm sure the members of the public have made a call, you've seen it on social media. I believe you're in the process of dealing with these lifts, which are almost 30 years old.
The lifts are old, and it's high time that it needs to be replaced. And that is why for this financial year, we have been given allocation to purchase lifts. And we have purchased 4 lifts, which will arrive at the end of probably Feb. And again, it will take another 2 months to install those lifts. So something good to look forward to in terms of replacement of lifts. But then again, these are old lifts, and the bottom line is they need to be replaced.
You had a situation also with one of the nurses where it was circulated. We saw a mop handle blocking a lift door and a fan pointing into the lift. Apparently a nurse who is asthmatic had transported a patient and was on her way back up to her level when the lift wouldn't open. So you also have your staff going through some very traumatic experiences.
Yes, those are the risks that our staff do encounter on a daily basis. Transporting patients, whether by lifts or lifting or pushing them, comes with the risk associated with how they're transported. That being said, we try our best to ensure that we cover all angles in terms of any outcome that might happen for which we do not want. For the incidents in that case, it was something that shouldn't happen, but it happened because we are dealing with very old infrastructure and old lifts.
And this will be fixed from Feb, 2 months, we expect new lifts to be installed.
Yes.
The International Women's Association Fiji President Judy Compain had said that you would have seen her statement that they had offered to buy a new lift, and they were told that there's money there, so don't need to do that. She had insisted that why refuse the offer when they could have helped. What's your comments on that?
So the issue with IWA, especially Ms. Judy Compain, is usually she goes ahead with planning, and for us here at CWM, our go-to people will be the Board of Vistas, and the Board of Vistas, they liaise with our medical superintendent, simply for the fact that it's not only IWA who's doing good work here at CWM, there are a number of organizations, individuals, religious organizations who are doing the work. And it's just, we just need good coordination from our end, so to ensure that work is not replicated. And for this instance, we had already budgeted for the 4 lifts before, I believe, they had did their fundraising for the lifts. But look, we always welcome IWA and the work that they do. They've done a lot of good things within CWM, and there's more people putting their hands up, an organization, and we welcome them.
And hopefully with urgency we get these services moving, just like the lifts.
Very much.
In terms of outsourcing theatre services, how much are you spending while these theatre services are down? What is your rough estimate?
So it was scheduled for 6 months, and in that 6 months we were planning on doing mostly the elective cases that were backlogged. In terms of the amount, it's probably in the range of $2 million.
So your ideal situation would be the Works Ministry finishes off the theatres and we get all those surgeries done here.
That is...
Let's talk about maternity health services. We know the previous government for many years had said that there will be an extension of the maternity hospital, another 200 beds. We see the signboard there. We haven't seen anything else apart from the car park facility being cleared. There's a lot of our mothers, our sisters, our wives who have been going to CWM hospital. Maternity facilities are not perfect, and even right down to unhygienic and improper toilet and bathroom facilities. These are our women who go through very traumatic experiences while giving birth. What is the plan for the maternity hospital?
So the plan as it is, the initial plan was to build an extension of the maternity hospital. I believe that was the plan within the previous government, and I also believe that due to COVID, most of those plans were shelved. But nevertheless, when we came in, we realized that yes, some of the infrastructure has been torn down to make way for this extension. But we had a plan that we just, for the time being, we need to do some refurbishment, roof changing, painting on the current infrastructure, while we plan for ahead on what the extension would be, the funding, and again, with a master plan in place, that will allow us to factor this in on the extension of the maternity hospital, especially the service that it provides. But nevertheless, the good thing that the previous government has done is also build the Makoi birthing unit, which is an extension of the services being provided here at CWM that's being decentralized out there within the Suvarnasori corridor.
Issue about cleaning services, we know that keeps coming up about the unhygienic conditions, the toilets, the bathroom facilities. What can be done to ensure it is conducive to what it should be?
It just needs to be reviewed, especially how we outsource the cleaning services to those successful bidders. Look, we have to take into consideration that infection prevention control guidelines that now that CWM is adapting to or following to ensure that the cleaning services also do provide those standards. But it is a challenge, and it's something that for this government will have to review the contracts that are giving to ensure that it aligns well with the standards that we want.
People are also asking about the term of the CWM Hospital Board of Visitors. Maybe you need more help in that area. I know you as the minister eventually do send out expressions of interest. Is the period of the current Board of Visitors coming to an end? Are you expected to call for expressions of interest for those who may want to join in a new term?
Yes, look, Board of Visitors, since taking this role, I have asked that all Board of Visitors be reinstated, especially in the main facilities, right down to the subdivisional level, even some health centers. But the Board of Visitors, they have a role to play. It's enacted. They report to the minister, and they do have a period in which they work in. For the ones we have now, they are very active. Like I said, some may not see that the good work that they are doing, but when the time comes for expression of interest for new members of Board of Visitors, the opportunity will be put out, and people who will be willing to put up their hands can apply.
Just in relation to, you have said that you're waiting for the Ministry of Works and other stakeholders to act and to deliver effectively and efficiently. What is your message to the people out there who may have some capability to assist you as well in different forms? Like we know some of the corporate sectors have taken up different wards to assist government as well in the past.
Yeah, we're still doing the same. We're still doing it. As you said, some corporate members within society has come on board and taken over a particular ward. But the challenge in trying to address infrastructure improvement, if you're going ward by ward, is that some of those wards have never been empty for a certain period of time. Therefore, you can only do so much as do things, do smaller works within those areas. But there is always a need for assistance, for help within the private sector. And as I mentioned, most coming on board to assist CWM, banks, religious organizations, individuals, both locally and overseas. And we always want to share their names and of the organization individuals, but they would rather they be kept anonymous and just continue with the good work of supporting CWM.
You're grappling with CWM Hospital, and we see how it plays out in the next few months. What about the other facilities? We know CWM is not just a Suva hospital. It also provides some of the services, our national service. What about the other hospitals in the west, in the north, in the outer islands? What are you facing with them, and what is your plan going forward?
So it's the challenge is the same. As you go away from CWM, you're looking at the Suvarnasori corridor. You have facilities all around Suvarnasori corridor, from Lami right up to Nosuri. They deal with the decentralized services that has been decentralized from CWM, mainly general outpatient, some special outpatient care, and emergency. But in some of those facilities, again, the same issue of infrastructure improvement needs to be done there also. Then you have a human resource issue as well. Then you have things such as equipment. So the challenge is quite the same. And if that is not being taken care of at that level, then still CWM will be inundated with cases that could have been taken care of at the at the referral centers.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
Oh my gosh! Oh, what's in the box?
You're probably wondering, what's in the box? Well, if you must know, it's actually me. Before you call the police, I'm actually an app. The all-new Fiji Village app. Here's an update. See what I did there? I gave you an update. What's new? Well, for starters, I look different. My new layout also comes with stories if you're looking for something short and sweet. I will bring you the latest news on the dot so you stay updated. You're welcome. You don't have to go anywhere for content because I bring the content to you. Not only can you listen to your favorite radio stations, you can also watch online video content. Which reminds me, do you love sports? Well, guess what? With the Fiji Village app, you can stay up to date with your favorite sports and scoreboards, no matter where you are. Your #1 news website just got better with an app. Download and get updated now.
Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We're here at the Fiji Pharmaceutical Services Center and with the Health Minister, Honorable Dr. Ratu Antonio Lalabalavu. Dr. Lalabalavu, medicine shortage has always been a concern. For the last 2 years since you've become Minister, that issue has remained. It's not a new issue. It has been there even before you came in as Minister for Health. Have you found a solution?
Thank you, Vijay. In terms of medical shortages, as you rightly said, it has always been an issue. It is nothing new. But since taking office, we have talked over with our team here at FPBS on some of the new initiatives, some of the new processes or ways that we believe that if we go through this way, we will improve the availability of medicines and consumables. And one such program is is what we call the M Supply. It was launched last year. What the M Supply does is provide real-time data on the availability or stocks of all the medicines that should be available right down to the nursing station, and also at those facilities they can view the stocks that are available within the main supply center, which is FPBS. It is available throughout our 220 healthcare facilities, but it just needs connectivity to enable the user to update the information. That is an area which I believe will be a game changer in terms of the availability of medicine and restocking of medicine within. The other thing that now that we've asked Deputy Prime Minister, Minister of Finance for his visit, that we have identified some areas which I believe are low-hanging fruits, through which members of the counting team or the procurement team here at FPBS can, on a regular basis, talk it over with our team at the Finance and Treasury to allow a smoother or streamlined process of procurement. And then there are issues with the supply chain. It's something that is beyond our control, but it's something that the team here at FPBS from time to time try and ensure that if items are delayed in coming in, we can access it through other means that is available within the ministry.
So you would know that at times right now in the last few months a lot of concerns have been raised about blood pressure tablets, including antibiotics, and also issues about the full blood test kits, gynecology test kits. What's happening with those? How come we end up with that situation knowing that these are critically needed?
There are a number of reasons whereby certain medicines or consumables are in low numbers or stockouts. I can only mention one that, again, it's something that is within our control, and that is to do with how stocks are updated from the facility and also within the main supply center. The stocks and how this facility function is a warehouse and a delivery service as well, to deliver throughout Fiji the items that are needed within the facilities. They can go, there is a timetable for their delivery, but in instances where there is a need of some life-saving medications, life-saving equipment, then their role is to supply it immediately. Again, the stocks for which they supply are dependent on the user, which are our staffs that are working in the facility. So you can factor in sometimes their role, they're not updating their stocks, or it can be the fault of this facility as well. So it is about trying to ensure that we have a good operational facility, and that the process is streamlined, because together with that, government through development partners, we have also established warehouses in the north. We'll be soon opening the warehouse in the north. As you can see, we are interviewing here in one of the main warehouses at FPBS. It's nearly full to capacity, and that is an area of concern as well, the storage space. So the plan is introduce one in the north, and then lately we'll be doing also another one for the west.
So in terms of you with your medical background would also know that medicine, critical medicine needed, is also a life and death situation, and doctors, nurses who are at the facilities need this as well. The last thing they want is to be telling their patients, sorry, we've run out, you have to go and source it somewhere. How are you dealing with that when it comes to dealing with patients who are going through this on a daily basis?
So stock out, as I said, it's nothing new. Something that has been there from the past, and hopefully with what we are doing now, we'll try and correct it. One of the new initiatives that I believe most of the public do not know about is the free medicine scheme. Our registration team is also here at FPBS, and they go out into the various divisions and do registration for free medicine. So there are a list of drugs or items under the free medicine scheme that if it is not available within the government pharmacy, that same prescription they can take it to the private pharmacy and source it from there. So that is an area we believe that can be a substitute for something that we don't have. But nevertheless, the aim is always to try and improve that we do not have stockouts. to say that in the future we will not have stockouts, that it will be something that we'll need to work very hard for.
The Medical Association has been saying that one of the issues that needs to be looked at is the procurement, that for every purchase that you make, you need to get 3 quotes, and that may become quite time consuming and to fulfill that. What do you think about that? Are you constrained by those kind of guidelines?
The procurement process for 3 procurement has been there for some time. It's just about having a proper plan, forecasting what needs to be ordered. The new system that we have allows us, if the users are updating regular information, it allows us to show the trend of certain medications, and the trend will tell us, okay, together with probably an outbreak of flu or any other illness, will tell us, okay, you'll need to order this at the right time. As I've said, within the facility, the onus is left up to those that use the equipment, and especially to restock their supply. It's user dependent, and if the user is telling us we have this in stock, then we will not supply it. But going back to your question, it is something that the team has been trying very hard the last few years to try and improve on. We're using this new system. It has some early teething issues, and it's something that I believe that discussing amongst the group and amongst the speciality of this area, we'll definitely try and improve on it.
How are services getting affected in terms of the doctors and nurses when they are affected by this? That has been stated as one of the push factors for doctors and nurses leaving, that if they cannot be treating people with adequate medicine supply, they need to move to somewhere else where they can do that. You come from that background. You worked in the hospital facility. What's your thoughts on that?
Yeah, when we experience something like that, it's as you rightly said, it's a push factor, whereby you try and deliver the best medical services that you want to deliver, but you're limited by what you have. And that is always the challenge. It's the challenge when I was working within the ministry, and it continues to be the challenge now. I believe going forward, if we have proper planning, to do proper planning, to ensure we do procurement on time, to ensure that that we know what the challenges are, and not to use the same excuse to say that this is why the medicine is late. I know, they know, that these challenges have been there for some time. So it's how we work smarter. And I believe there are new programs in place within the ministry, especially FPBS, the procurement process. And again, it's something that we will need to discuss. And as we discuss, things needs to be changed so that we get the items here on time, then it has to be done.
The other thing, Minister, is about doctors and nurses. They're saying that they have to even bring in things like syringes to be on standby for people to use because they may not be adequately available. And we know that you have said that depends on what they have, But if it's not available and it's needed at that time, the fact that they're carrying it in their bags, buying it to make it more comfortable for the patients, what can be done to ensure that these issues do not arise?
As I've said, for the examples that you have mentioned, shows how dedicated our staffs are in delivering adequate healthcare service at the expense of the shortages of items. The issue of shortages, whether be it drugs or consumables or any item that is used for healthcare service, delivery of good healthcare service, it's an area which I believe will need good and proper planning, because as it is, we order 100% of all our items here from overseas. And definitely, we will have to anticipate, proper planning, we will have to anticipate these shortages. So, what's the alternative for us? There are other processes which we follow, such as RFQs. We can buy it from the private pharmacy. But if it is not escalated to that information of the availability of items, if it's not escalated to facilities such as this, then we won't be able to rectify the situation. But vice versa, if we are not doing our part, then people here should be taken to task of not doing their part, because it's affecting service delivery and it's affecting lives as well.
So you want those people to come forward to you if there's issues like this?
Yes.
You know, it's been reported now, the chronic lack of basic essentials, things like it's being said that unsterilized equipment is being used because of a lack of equipment, and that includes the different equipment that is used at the hospitals. Can you attest to that, and what is being done about it?
So the use of unsterilized items is not advisable, or we do not allow that to be practiced within our facility. Maybe some of the items that should have been used only once are now being reused, but those items are usually sterilized. For instance, it has been said in the media on tubings or masks for nebulizer. That's nothing new.
But they have to be sterilized?
They have to be sterilized to be used. If it's not sterilized, then it should not be used. And if you are aware of, if the public is aware of staff who are doing it, I would recommend that it be brought to our attention.
So, in terms of drugs, high rate of using hard drugs, cases are coming up every day. Issue about harm reduction and rehab. It's something that you definitely are looking at. Questions are being raised about drug rehab centers and St. Giles Hospital, overwhelmed by the number of people coming through, apart from just purely mental health cases. What's your plan for that?
So under the narcotics, under that initiative, our role at the Ministry of Health is harm reduction, as you've said. But to do our role effectively, we still do not have the relevant or the appropriate support in terms of having an infrastructure in place, ensuring that certain medications are available. But through our stakeholders, which is the relevant stakeholders, which is St. Giles, and in discussion with some of development partners, we are already in the process of we have a plan. It's what we call the mine farm. That will be a place whereby rehabilitation is done for drug addicts, and also to ensure that they have learned some new skills as practiced in overseas. Also, right now we are trying to improve. We have already begun in terms of caring for acute patients who are on hard drugs. That can be seen at the St. Giles Hospital, at our own accident and emergency, the main hospital, and some of our NGOs who assist us in this space. But definitely the medium to long-term plan is having a rehabilitation center.
When will that be ready?
At the moment, since it's just planning phase, but because of the escalation of this problem,
It's quite urgent.
It's very urgent, and it's something that the language that the Prime Minister is talking of is around the same as what we want the Ministry of Health.
So when will it be done?
Probably
We can't just keep planning. When will it be done?
2 years, or
2
a
years
year,
from now.
or two.
And
Look,
in the interim period, what will be?
In the interim period, we will have to look at what can be done alternatively in terms of the support, structure and the support capacity that we have in place.
Through St. Giles.
Like I said, St. Giles, using our accident and emergency department, using some of the NGOs that are assisting us in this space.
Mental health is, since COVID, the country has seen a surge of mental health issues with, of course, a lot more stress, a lot more trauma, a lot more young people battling with everyday issues, which is resulting in these cases. Do you believe that we are ready for the number of cases that are now on the rise?
Mental health has been rising post-COVID, or during COVID, post-COVID, and as such the ministry prioritizes mental health and the issues that comes with the mental health. In terms of support, yes, we do provide that to our staff because we have to ensure that our staffs are well taken care of to be able to effectively deliver good health services. We need to take care of our staff, and the component of mental health is also included in that. In terms of looking out of the population, that is something that we are strengthening with our teams at St. Giles, and to ensuring that we have certain parts that are dedicated within the wards to look after mental health and usually called stress wards.
In terms of HIV, we know you've declared an outbreak. We need to intensify our efforts. We can clearly see the vulnerable group between 20 to 29 years old. Majority of the people captured in this January to September figure, Ito-K make about 90% of those after tests confirmed to be infected. And also in terms of injectable drug use, the causes, the numbers increasing there to more than 200 just between Jan to September, which is no doubt a big concern. We need to intensify our efforts. I think the whole country went to sleep in terms of awareness campaigns for HIV for 16, 17 years. You have your work cut out. You've declared an outbreak. What is the next step?
So before declaring an outbreak, we had launched our surge strategy for 2024 to 2027. And that surge strategy was the initial plan when the numbers were still below the 400s. But after it went past 500 and 1,000, then we had to readjust our plan to ensure that we have to plan for an outbreak. The 90-day plan, 90-day outbreak plan, which was also launched as part of declaring an outbreak, will ensure that we scale up initiatives to deal with the current outbreak. And the aim of those of the 90-day plan, the basic, the bottom line achievement of it is to reduce the transmission rate. So, in escalating some of the initiatives, it's to ensure that we have ARVs, antiretroviral medications readily available, testing capabilities, and awareness. We go out hard on awareness, and in doing that, we will be incorporating like a whole of government, or whole of community approach. We go hard on targeted interventions, because as the numbers are more than 1,000, we still feel that we are not targeting the testing to the vulnerable groups, simply for the fact that for people who you want to test for HIV, or people who are living with HIV, there's one thing testing for them, and there's another issue is following them up and ensuring that they are on treatment. So how we will do that, we'll just have to readjust how we do things so that we can go for a targeted approach and ensure that the people we are sending over to do these things are accepted by the vulnerable community, so as to allow them to trust us, come forward for testing, and pass on the message to their friends and families.
My final question is about your HR strategy. We got to hold on to our professionals. I see that the doctors' salaries is stabilized, and you giving some figures that we have about 90% positions filled. The doctors are not leaving in droves. You had a situation with the nurses leaving. The nurses were unhappy with their pay, and also other issues. They continue to raise concerns about their work conditions, even their allowances, like meal allowances, the consumables made available, or at times they doing the work when there's no doctor available at certain health centers, and leads to frustration. What is your plan in terms of making sure that you hold on to the nurses and the complement of staffing is adequate?
So the main plan is looking after the push factors. So when we're talking about the push factors for our staffs, what's pushing them away to go out of public service into the private sector overseas, it's mainly to do with just a number of things. One is remuneration. For a certain period of time, they felt that they have been on the same pay, while the scope of work has increased. So therefore, We are talking with the relevant cadres of workers to come up with a submission, and if the scope of work has increased, the last time they had a job evaluation exercise, things like that, and with those submissions, we definitely support those submissions, and we'll escalate it up to the Ministry of Civil Service. But nevertheless, for the ones that we have improved on, it has come through that process. The other one is to ensure that the infrastructure that they work in is conducive. In areas whereby we send our staff to go and not only work, but also live in that facility, we must make sure as a ministry that it is workable and livable, and ensure that the basic necessity of things is available there, such as wash items, electricity or any mode of electrical supply, whether it be renewable or through the grid, ensure that connectivity is available. So these are some of the smaller things. And also taking care of issues such as allowances, and ensuring that they have the equipment to work with, the medicine, consumables are there so that they can effectively do their work. So we've seen that if we improve that, for areas that we have improved on that, we have seen that staffs are willing to stay back and serve in those areas.
Minister for Health, thank you very much. We've covered a lot this evening. You've opened the doors to us and to the people of Fiji to show what is the situation at hand in terms of our infrastructure, in terms of our consumables, in terms of human resources, a critical issue as far as health is concerned. We'd like to thank you again for that, and we also know that it is no easy task. A lot of work lies ahead, and as you've said that you promised that you will have some concrete delivery and the steps already being taken. We're looking forward to that. So we thank you again for coming on our show tonight, and until next week, have a great evening.